Today we're diving into the world of thumb injuries, specifically the ulnar collateral ligament or UCL injury. This condition, often called skier's thumb or gamekeeper's thumb, involves damage to the ligament at the base of your thumb. Whether you're an athlete, a weekend warrior, or just someone who uses their hands a lot, understanding this injury is important. We'll explore what the UCL is, how injuries happen, and why they matter. By the end, you'll have a clear picture of the causes, symptoms, diagnosis, and treatment options for this common hand injury. Ulnar collateral ligament, or UCL, is a key stabilizer of the thumb's metacarpophalangeal joint. This ligament connects the bones at the base of your thumb and keeps the joint stable during gripping and pinching. When the UCL is injured, it can lead to pain, weakness, and instability, making everyday tasks like turning a key or holding a pen difficult. Understanding the anatomy of the UCL helps explain why injuries can be so disruptive and why proper treatment is essential for regaining hand function. CL injuries are classified by how and when they occur. Acute injuries, often called skier's thumb, happen suddenly, usually from a fall or forceful impact. Chronic injuries, known as gamekeeper's thumb, develop over time from repetitive stress. The severity is graded. Grade 1 is a sprain, Grade 2 is a partial tear, and Grade 3 is a complete tear with joint instability. Recognizing the type and grade of injury is crucial for choosing the right treatment and predicting recovery. Steno lesion is a specific and serious type of UCL injury. Here, the torn ligament gets caught above a nearby muscle, preventing it from healing on its own. This usually requires surgical intervention. Recognizing a steno lesion is important because non-surgical treatments won't work, and delayed surgery can lead to long-term problems. If you see a lump on the thumb after injury, it could be a sign of this lesion. Doctors use classification systems like the Romano and Milner systems to describe UCL injuries. These systems rely on imaging, especially MRI, to determine the extent and displacement of the tear. The Romano system categorizes injuries as partial, non-displaced, minimally displaced, or moderately displaced complete tears. The Milner system further refines this into 4 types, guiding treatment decision. Some injuries can heal without surgery, while others need operative repair. UCL injuries are surprisingly common, making up the majority of thumb base injuries. They're especially frequent among skiers, athletes in racket and ball sports, and even motorcyclists after crashes. Risk factors include sports with a high risk of falls or direct thumb trauma. Understanding who is at risk helps with prevention and early recognition, which can make a big difference in outcomes. UCL injuries often occur alongside other hand injuries, such as fractures or dislocations. For example, football players may experience metacarpophalangeal joint dislocation or carpometacarpal dislocation of the thumb. Recognizing associated injuries is important because they can complicate treatment and recovery. A thorough assessment ensures that all injuries are addressed for the best possible outcome. Understand UCL injuries. It's helpful to know the thumb's anatomy. The thumb has unique bones, joints, muscles, and ligaments that allow for a wide range of motion and strength. The metacarpophalangeal joint, where the UCL is located, is especially important for gripping and pinching. Muscles and tendons provide dynamic stability, while ligaments like the UCL and radial collateral ligament offer static support. This complex structure is what makes the thumb so versatile and vulnerable to injury. Most UCL injuries are caused by forceful abduction or hyperextension of the thumb, such as falling onto an outstretched hand or receiving a direct blow during sports. Chronic injuries can result from repetitive pinching or gripping motions. The ligament may tear partially or completely, sometimes pulling off a small piece of bone. Understanding how these injuries happen helps in both prevention and early diagnosis. Patients with UCL injuries often report pain, swelling, and bruising at the base of the thumb, especially after a specific incident. They may notice weakness, instability, or difficulty with pinching and gripping. On exam, doctors look for tenderness, swelling, and sometimes a visible lump. Assessing range of motion and joint stability is key to determining the severity of the injury and planning treatment. Diagnosing a UCL injury involves a careful history and physical exam, but imaging is often needed to confirm the diagnosis and rule out fractures. X-rays are the first step, looking for avulsion fractures or joint misalignment. Ultrasound and MRI can help distinguish partial from complete tears and identify steno lesions. Accurate diagnosis ensures the right treatment and better outcomes. For partial UCL tears or minimally displaced injuries, non-operative treatment is often effective. This usually involves immobilizing the thumb in a splint or cast for 4-6 weeks, followed by physical therapy to restore motion and strength. Pain can be managed with acetaminophen or NSAIDs. Most patients recover good function with this approach, especially if treatment begins early. Surgery is recommended for complete UCL tears, steno lesions, or injuries with significant displacement. The goal is to restore ligament stability and thumb function. Techniques include direct repair, ligament reconstruction, or joint fusion in severe cases. Early surgery, ideally within 2 weeks, improves outcomes. Postoperative care involves immobilization, followed by gradual rehabilitation to regain strength and motion. Most patients with UCL injuries recover well, especially with prompt and appropriate treatment. Non-operative cases often regain full function, while surgical cases have high success rates, over 90% in many studies. Athletes can usually return to play within a few months. However, complications like stiffness, persistent pain, or arthritis can occur, especially if treatment is delayed or incomplete. In summary, UCL injuries of the thumb are common but treatable. Early recognition, accurate diagnosis, and appropriate management, whether non-operative or surgical, are key to restoring hand function and preventing long-term problems. If you experience thumb pain after an injury, don't ignore it. Prompt evaluation and care can make all the difference in your recovery and return to daily activities.